So I don't often share case histories here because I'm quite protective of my patients. I would love to have any patients who want to volunteer their case history, but I don't tend to ask people. However, this is one who wasn't really a full-on patient. It was someone that I knew through a friend who lives abroad, so I wasn't able to make her up a normal, proper holistic prescription. But we had a quick chat, and it was around the fact that she had been diagnosed in the past with borderline personality disorder, which is characterized by various symptoms, one of which that was really bothering her, which was this emotional volatility and feeling very, very depressed at times, feeling very fearful, paranoid, anxious, and so on. But when I actually got to talking to her a little bit more, we found that this symptom, or this problem that she was identifying, was happening specifically right before her period. And so I suggested to her, it may be that you're suffering from a kind of severe PMS known as premenstrual dysphoric disorder, or something in the realms of that kind of presentation. And so it may be a hormonal thing that I can help with. So since she wasn't in the UK, all I suggested to her was to find herself a supplement of Vitex Agnus Castus. And I said, let's just try this initially. I don't know if it's going to be that helpful because it's just one thing, but let's try it. And she found that after about 1 to 2 months, she noticed a huge improvement in her symptoms. And she found that the symptoms that were bothering her were no longer particularly strong. She felt that she had, normal PMS, and it really threw into question the whole diagnosis that she'd been given in the past. Now, having said that, many people who have borderline personality disorder are then not diagnosable after a couple of years, because people shift, people change, and people grow, and people improve. So I did mention that to her, and that was something that was really, really helpful for her to bear in mind, so that she didn't have to feel burdened by this diagnosis forever. And she could see herself where she was right now, which was someone who had grown a lot and was able to be functional in a normal relationship and so on. So it was a really nice, short little example I wanted to share.